Now, I want your calls on this. I suspect people are dialing as we speak. Should schools be teaching children how to brush their teeth? As I just mentioned, staff in schools and nurseries in England are being asked to supervise young children while they brush as part of a national scheme to improve dental health. It's following practices that have already been in place in Wales and Scotland for almost 2 decades. Teachers will help without directly brushing the children's teeth at some point during the school day, but it's not meant to act as a replacement for toothbrushing at home, but build good skills and habits. But our question is this: is this something teachers should be doing, or do you think parents should take responsibility? Look, Suzy and Mike, just to throw out a statistic so people understand, why this is being thought of in the first place. About one out of every 4 5-year-olds in England has tooth decay. And in poorer areas, that is 1 in 3. And this was something that shocked me, right? Tooth decay is the most common reason 5 to 9-year-olds in England are admitted into hospital. Now, you're a mum, Suzy. Is it your responsibility or is it the schools?
Ultimately, it is the parents' responsibility to make sure their kids are brushing their teeth. But the fact is, we don't live in a perfect world or a perfect country, and there's lots of parents that maybe, for different reasons aren't making sure that is happening. This is costing our NHS a lot of money. This is causing a lot of problems. We know that because of already these programmes that have already happened, it reduces by 50% tooth decay in some of these, by 50%. So for me, this is about, look, it's not an ideal situation, but we invest the money here to save the money there. And we're also helping those kids to make sure they're not tooth extraction is going on. It's madness.
Mike Parry, she has a point, saving money for the NHS.
Of course, Suzy has a point, and she makes all those points very well. But for me, the drift of responsibility for children from the parents to the school is growing. We have breakfast clubs. We have some children need to be potty trained and toilet trained at school. Now it's to brush their teeth. At what point do you say, hang on, responsibility must rest with the parents. The more you let it drift to the school, the lazier parents will get. On the tooth thing, by the way, I think the major problem with children's teeth is we don't have any National Health Service dentists. We just don't. I don't use one because I can't find one. Last time I came out of a dentist, I paid 500 quid. If a child arrives at school and its teeth are starting to rot, that parent who comes to pick up their child after school should be told by somebody in the school, your child's teeth are not good, we're reporting you. That's what should happen.
Well, Suzy, it is true about NHS dentistry. It is a postcode and a regional lottery, right?
And well done to Wes Streeting, because Wes is doing everything in his power to turn that situation around, which is obviously because of 14 years of a Conservative government that didn't invest.
But are more emerging.
We've been in 8 months and Wes is turning that around. But it is right. We do need to make sure that people have access to an NHS dentist, 100%.
Yeah.
I wonder, though, there's so much pressure on teachers. I
totally agree.
There's so much pressure on teachers in terms of time. Isn't this another thing we're inviting them to do?
Even the National Association of Head Teachers say we've got to be very careful because what is ultimately a parental responsibility is being shifted onto the burden of teachers and schools. That sums it all up.
Look, but if you use that, you would also say, OK, well, if a kid is from a home where there is some form of dysfunctionality or deprivation or neglect, and they're turning up to school and they're hungry, well, we're teachers, we're not going to help them, that's not our responsibility. Well, it probably isn't their responsibility, it's the parents' responsibility.
Yeah.
Unfortunately, we live in a world where these things happen, and therefore we must have intervention. The fact is you've got this going on with kids. Do I think parents should be doing it? Yes. Do I do it as a parent? Yes. But for those parents where it's not happening, for whatever reason it's not, we are saying that actually we're going to have these programmes, and it is working.
But those are individual cases, Suzy. If you get an individual case of a child whose teeth are rotting, then you focus on it, you go to the family. Same if a child is hungry. But you can't have it as a whole-scale programme that every child's teeth will be cleaned. Every child will get breakfast in school. It's just ridiculous.
Let's see what Linda in Kent thinks. Is this parents or is it the job of teachers, Linda?
Of course it's not the job of teachers to make sure that children are having their bums changed and their teeth cleaned. That's the parents' job. That's when you have children. It's your responsibility. I would have been utterly ashamed to go to a school and for a teacher to come out of the classroom and say to me, Linda, your son has got terrible teeth.
Yeah.
I would have been devastated. I
Linda-
would have gone home in tears.
Linda, I hear you, and I suspect there's mums and dads across the country who are clapping and agreeing with you. But the problem is that when that's not happening, there's a kind of reality here, which is the statistic that I gave, which I was surprised by, that the most common reason for 5 to 9-year-olds to end up being admitted to hospital is because of their teeth. So,
Well,
isn't it better
I'm
that the schools help so that we save money on the NHS?
No. You've got to go to the parents and you've got to be harsher on the parents.
What would you do?
No pussyfooting around. No pussyfooting around and being nice and flowering it up. You go to them and say, your child's teeth are terrible. And obviously, if your child's teeth are terrible and they're coming to school in nappies, you're not doing your job properly. And if it doesn't change, I should go to social services about it. Because that's how you've got to treat people, not flower it up and
well,
say,
can
oh,
I,
please, can you do this?
Linda? Well, thank you for your call. You put that very powerfully. But you know, there's another issue here, which is something called hygiene poverty. That I'm very privileged. I don't live in hygiene poverty, but 2 out of 3 parents experience that. They say that they've had to choose between buying hygiene products for themselves or their kids, and 3 in 10 parents, that's nearly a third, experience hygiene poverty, say their children are now having to use lesser quality dental care products than before. So there is a cost of living issue here. It's not just necessarily about parents being negligent, Linda, right?
Well, I'm sorry. I think that a toothbrush and some toothpaste, you don't have to have the most expensive, because I was told by my dentist some of these expensive toothpastes are no better than the cheaper ones. So
right.
A toothbrush and some toothpaste is quite cheap.
Well, I hear what you say. I hear what you say, Linda. Your first point, I think, is the one which I suspect is what's going to be exercising most of the country. Broderick, you're in London. Look, is there a role for schools in terms of health here?
Absolutely not. The schools are there for the children to learn history, maths, reading. I believe people get married, have their first children, they should go to school, learn how to bring up children from an early age, what the children needs,
right?
Whether at this date or that date go to dentist. It's a school for adults.
So you'd have parenting. You think all prospective parents should take part in parenting classes. I have to say there'll be a lot of people out there that don't think that's a terrible idea, even if it is, as Mike might be worried, more of the nanny state, but nannying for parents rather than that taking place in school.
Well, look at the cost you save. Look at the cost you save. If a child is brought up how to look after itself, then it's less time to the hospital.
So you say that the parents need to go to school, Broderick. It's a very interesting point. Cheryl, you're in Wales. This has been happening for some time in Wales, I think.
Yes. Sorry, I can't hear you.
Hi, Cheryl. I think you're in Wales. And the interesting thing is that schools in Wales have been teaching kids how to brush their teeth for some time.
Well, let's face it, be honest, lazy parents.
Lazy parents?
Yes.
And so even though it's been...
They are. The school is not there to be a mother. If a child falls, of course there are instances where they do come in, but they are not there to teach children potty training and things like that. When I was in primary school, the dentist used to come to the school 4 times a year.
Yeah, that happened in our school as well. Cheryl, it's an interesting thing because you're from Wales. This has been kind of piloted there for some years and to some success. And the reason for that is when you teach kids good health habits, just like you had at school and I did with the dentist coming in, it means that less kids end up using the health service. So there's an economic case here.
Yes, precisely. But what I'm saying is, why are these children? Why are these parents?
Well, Cheryl, I think we've lost you there, but I think what you were about to say is what our previous caller said, which is Broderick, which is we need more classes for parents. I'm going to go over to Colchester. Emily, would you support classes for parents?
Absolutely. 100%. I like the idea of the dentist coming into your school, like you said, for you. That teaches you. My mum was a hippie, and we were in a Land Rover for a couple of years going through Europe, and brushing teeth was not a priority. But I wish it had have been. My teeth were awful. I didn't teach my daughter because I wasn't taught, and she's going to chuck me the £2,000 bill that she needs for her teeth now. But that's absolutely fine. No, because I should have taught her, and I wish I had known how bad it could be and how expensive it could be, but I didn't, and I wasn't taught. And if anyone had told my mum that my teeth were bad, she would have told them to go away.
Emily, can I thank you for calling in and being so honest about that? Because I think a lot of people out there aren't necessarily as authentic as they should be about their failings, albeit perhaps even some cases, you know, reasonable and noble ones as parents. Just ending before we go to the break, Mike, it's been interesting. A lot of people saying, look, don't teach the kids, teach the mums and dads.
Yeah, I think that's a very interesting aspect of this argument, but I think that is further away in terms of what is the art of the possible than actually teaching the children to clean their own teeth.
Look, all I'm going to say is we all want the parents to take responsibility and do this. We're in a situation when that isn't happening. So therefore, the government is making sure that we're filling that gap, because otherwise there's a massive NHS bill that taxpayers are going to pay.
Did you mean to do that on purpose, a little pun, filling the gap?
No, I didn't, but I've just done it. There you go. You know.
That's a little nice lead out. Later, it's the papers and everything else.